Stockholm, good afternoon, Berlin, Barcelona, and London. My name is Juergen Osterbrink, and within the next 15 minutes, I will present you the life of Addison Care, and then ask the technician to start my presentation, please. This will be helpful, thank you. It's about development and deployment of Addison Care. Next slide, please. I will, next slide, please. I will talk about the structure of Addison. I will talk about the deployment of the original US American version and the transversion and the deployment to the European version. I will depict you in a second some difference between the cultural changes and the changes in research and content. Next slide, please. The major health challenges, HCC and the EU, will be highlighted. Of course, also nursing care in the EU, the digitization from the viewpoint of the EU, and Telecare as innovative care concept. And there's helicopters flying by next to my office. We need, as quick as the helicopters be, a new viewpoint of our healthcare in Europe. Next slide. We face digitization and demographic changes interrelated, and here you see a nearly historical article from the British Medical Journal, where it was forecasted 1990 and in the viewpoint of 2020 that we will have 2020 almost 75% of our patients suffering from chronic diseases. And the forecast was absolutely correct. We're having mostly of our patients are elderly and suffering from chronic diseases. And that's why if the structure of our patients are changing, we have to adapt also our health system based on the major challenges. Next one, please. The beginnings are that we have to face differently nursing care with a different viewpoint than 100 years ago. And also in the US, the change started as early as 1909 with the first implementation of university-based courses. And we have seen throughout this 112 years a major change within nursing care and direct care in the US. But now we are facing worldwide an imbalance and a shortage of nursing care, of physicians, of physiotherapists, not only in the US, but also in the EU. In the EU member states, actually, nearly 3 million nurses are practicing on a diploma and or bachelor level. Also, that due to the fact that physicians and nurses, number of physicians and nurses are increased by 10% within the last 10 years, we will not cover the retirement phase of the baby boomer generation, and we will not cover the demands and the requirements for better health care of patients suffering from chronic diseases. Next one, please. That's why we have to, due to digitization, optimize healthcare at home. Our patients have to stay as long as possible with a good quality of life at home, and we have to foster autonomous living in old age. But are the technical solutions already on the market available, acceptable, and usable? And you will find within the next 9 minutes, yes. Next one, please. Pardon me. And here you can click throughout, please. Thank you. Due to digitization, we have already electronic health record installed in most Western societies. We are having a substantial health portal, online pharmacies, AAL system in the beginning of the development. We have as beginning phase telemedicine, especially for patient suffering from cardiac disease. But it's just the beginning. And if we combine telecare and telemedicine, then we are having a really innovative care concept. Next slide, please. There is a number of evidence, and you can click throughout this slide as well, please. Telecare for patients suffering from diabetes, from Parkinson, suffering from pain and depression, suffering from mental diseases. And I think that we have basic evidence, and now we have to find a way to combine the evidence with technological solutions and access to the patient's homes. Next slide, please. Telecare is not a new concept. Already in the 60s, you see here in the left upper picture that nurses at Norfolk State Hospital, together with a brave cameraman, are responsible for a structured patient education. As well, some years later, our Canadian colleagues are doing this as well, structured patient education. And Addison Care is Telecare 3.0. Addison Care moves into EU houses. Next slide. We will, and you can click throughout, please, again. We will integrate the to measure vitals. This is already integrated in the EU system as well as in the US-American system. We will help patients to deal with the medication management, to increase adherence. Now, since the last 20 years, we talk always about to increase compliance. But now, 2021, adherence is in the focus. And of course, a tutorial for our patients that they are feeling safe and good and informed. We will integrate video consultations by trained nurses on a master level, advanced nurse practitioners, also for GPs. We will integrate physical therapy protocols. We want to reduce falls at home based on an emotional analysis for gait, balance, and fall risk assessment. And we want to be 24/7 in the homes for patients and their direct caregiver, being a companion for patients and, of course, also the direct caregiver. Next slide, please. The benefits is an overall improvement of the patient health outcomes. And our first results are showing that it's easy to work with the platform of Addison. It's easy to communicate directly, and it's also easy to set alarms either by Addison directly or by the client. It's more effective and affordable methods of managing chronic conditions. For instance, if our patients are suffering from a cardiac disease, you have the control via the vitals and all vitals, whether your therapy is correctly administered, whether your patient has more substantial questions, and if so, there is a direct nurse, there is a direct GP or a specialist physician to take care. You reduce medication mistakes, reduce the number of primary and secondary complication. And also everything, every dot you see here below, increase the health economic output. Next slide, please. The next one, please. How we are doing this? We're having a natural language understanding and an automatic speech recognition on a platform on a modified desk that we can communicate with Addison directly. Next slide, please. Here, this is patient Juergen, still smiling, and he's calling Addison, and Addison responds, next one, directly. Next slide, please. And you can click throughout this again. Addison inform patient Juergen, we want to measure your vitals now. Do you need more help from my side, or do you need a primary nurse? Do you need your GP? And now we will manage your drugs. You take the right drug in the right time in the right dosage. I'm Addison responsible for you, Juergen, that you get a very safe environment. And this is important. We increase with Addison Care patient safety dramatically. Next slide, please. We are doing this in the patient homes. Our focus is in hospitals, nursing homes, and in closely cooperations with practitioners, nurse practitioner as well as GPs. Because if it's necessary, we will stay in very close contact with patients, other professions, direct caregivers. For instance, if you are treating a patient in a palliative care situation, you can be very closely not only monitoring, but also help the patient to stay comfortable. This is mostly important in a palliative care situation, as you know. Next slide, please. This is a development of our colleagues in the US. You see here a very typical kitchen. You see a very typical American living room. For the EU part, next slide, we modified the kitchen as well as the living room. Next slide, please. As you see here, this is a kitchen which is very normal for the northern and West European countries, and this is a more or less very common living room. See this always in comparison. Our patients have to be comfortable, and they want to see Addison in their home settings. At least they want to recognize that it's a similar home setting like at home. Next slide. The Telecare as conclusion, we have to have a good infrastructure for Telecare and use of technologies. Now is the time, 2021, where G5 is knocking on our front door, where this is our learning on due to COVID, due to the horrible pandemic. We have to have not only infrastructure, we have to use also the Telecare systems. We have to change to integrate patients into the care process on an ongoing basis and to adapt linguistic and cultural needs to raise professional care to a new system level. And you see here our next steps. I know, and I apologize for the misspelling of research. The research-based testing of Addison is fundamental because we are interested to offer an evidence-based system. We have first evidence, but we want to be very sure that everything what Addison is doing, is thinking, and is acting is on an evidence-based level. This is what we are doing. Next slide, please. Not only in Salzburg, as you see here, also in Stockholm, also in Barcelona, also in London, and also in other cities, big or small cities within the EU. And I'm very happy to answer questions, and thank you so much for your attention. And I'm heading back to the technician.